We also now, as we always do weekly, have the COVID-19 data report, and included with this now going forward is the Cook County Wellness Update from Brian Gottschall, Director of Berks County Department of Emergency Services. Good morning, Brian.
Good morning, Commissioner. Yes, October 14th weekly report. Looking at our first slide, cases and testing, we continue to see a rise in case counts throughout the county, although it is shallowing out even more. Recall that a couple weeks ago, we saw a little bit of a downward blip, and we were hoping that was portending the future, but it was not the case. We continue to see a rise, albeit more shallow than we had prior to then. We've seen yet another shallowing over the last 2 weeks or so. So again, we continue to hope that that continues to the point that it tips over the top and we get on the backside of this so-called Delta surge. Positivity following right along with that, we see that kind of downward blip that we had there, but then increasing again as we move forward. Positivity continues to track with cases and testing due to our very robust testing capability that our healthcare community has in Berks County. This is a new slide that we're bringing in for the first time this week. I'd kind of mentioned it as a preview last week. The state has begun publishing data with respect to pediatric cases, obviously very important for us, even though it's great news that COVID still appears to be less impactful on the young than on the old. There are certainly exceptions to that, and we do want to be concerned about our kids, but in general, it still looks as though kids are weathering COVID very well, but each of them that is a positive case represents a potential vector for spread in the community. And with schools reopening, even though precautions are being taken throughout the school districts in recognition of the requirements of Pennsylvania Department of Education, anytime you're putting groups of people together, that does represent the risk for the spread of the disease. So this slide that we're going to be using on a weekly basis will help us to understand how COVID is spreading in that under 18 community. The blue line representing 5 to 18-year-olds and case counts on a weekly basis, and the orange line representing 0 to 4-year-olds case counts on a weekly basis. Do want to point out that the kind of place we had to start this graph, the first body of data that the state published about this was aggregated data from the middle of August to the middle of September. So we basically took those aggregated numbers, divided them by the number of weeks to come up with an average weekly count to start the graph. And then the second 2 data points that are on the graph are the actual weekly case numbers for those age groups. And we'll continue to track this in future weeks in this report. Numbers at our hospitals, again, continuing to go up, reminding everybody that these are known and suspected cases in-house. Sometimes the data that's offered in other media outlets is only confirmed cases, so that's why there is a difference. But they, of course, track up and down together. We began tracking known and suspected, so it was prudent to continue to track it that way so that our numbers had consistency. But the up and down movement is generally equitable, irrespective of which specific data point you're looking at. The bottom line is that our hospitals are seeing more folks with COVID in the hospitals. And we continue to track the St. Joe's numbers that are offered in both a vaccinated, unvaccinated breakout, although Tower is not yet doing that. We hope they will. Unfortunately, our COVID deaths do continue to track up, not nearly in the slope that we were seeing in the end of 2020 and beginning of 21, but we are now in a very similar position to where we were back in the spring of 21 in that surge that took place in late spring, early summer. Our vaccine numbers, a very interesting data point this week with respect to our at least 1 dose numbers. We actually went up 4 places when compared to other counties in the state in that at least first dose number, which was a very large and unusual jump. We'll have to continue to keep an eye on that in future weeks to see whether that was a mistake that DOH corrects or whether that was some type of data catch up or a legitimate 1-week significant increase in that at least first dose number. We did not see that similar increase in our fully vaccinated numbers. So this slide represents a normal week-over-week progression as we continue to close in on that 70% of those over the age of 18 goal that was set by CDC and the governor back in the middle of the summer, I believe, at this point now. The state is right about there. Berks County continues to lag just a bit behind. Getting back to those at least first dose numbers and how that impacts our 70% goal, that has caused us to have a pretty significant increase here. And we are just about at that 70% number, even taking into account our consideration to those that appear to have gotten their first dose but don't appear to be progressing forward to completing their vaccine series. So again, the raw data puts us well over that 70% number, but understanding that statistics are showing over the last number of months that a large number of those people will not get their second dose, even backing those out of the statistic, if those who are likely to continue their doses would complete them, we do appear to be right at our 70% goal in the next 4 weeks. Again, not much change in this slide. We continue to lead Pennsylvania in all categories of growth for vaccination, except that 12 to 18 number where we trail behind. And interestingly, our growth is actually growing in all of those green categories, while Pennsylvania's growth is growing in the 12 to 18 category. So we're getting farther ahead in most of them, but falling farther behind in that 12 to 18 number when compared to the statewide average since the end of May. Just a reminder, as we have for the last few weeks, change in vaccine strategy. Immunocompromised individuals who have had their second dose and are at least 4 weeks out of either of the mRNA vaccines are eligible for a third dose to complete their full vaccinating series. And boosters are now available for Pfizer vaccinated individuals who are 6 months out from their second dose if they're 65 and older, or 18 to 64 and in high-risk conditions due to living or working conditions. All of that summarized in this slide, which we're now showing for the 4th time, so I won't belabor it, but I will remind folks that they can go to the World Wide Web and search on CDC COVID booster if they'd like to take a look at CDC's specific information about this high-risk category. We continue to endorse going to doyourpartberks.com, where that information that I just mentioned is also available as a link out, as well as significant other information about vaccinations. As Commissioner Barnhart mentioned, moving forward, we're going to wrap the Coe County Wellness biweekly report into our weekly data report in the weeks that Coe County issues it, and that's the point of these last 3 slides. So this is kind of new for us. I'm not sure that we're displaying this in the best way, but based on any feedback we hear, we may make some adjustments in how these slides are represented to get across some fairly significant and complex data. So this slide represents Coe County's efforts since the beginning of the pandemic. We're only tracking the data going back to July the 8th, but you can see a continuous growth. Moving from a little over 16,000 to now a little over 18,250 total contacts that Coe County has worked on, with the vast majority of those being successful. They're now at well over 12,000 successful contacts out of the just about 18,250 efforted contacts that they've made since the beginning of the pandemic. And if we look at that a little bit more granularly in a 2-week period, again, going back to the beginning of July, we see this breakover between the green and the red lines kind of shows their successful percentage in each 2-week period. And they continue to remain in the neighborhood of that high 60s, low 70s percentage of successful in their efforts. What you can see if you look at the sum of the 2 displayed numbers in each 2-week period is that the number of contacts that they're attempting to trace is continuing to go up. Back in the beginning of July, DOH had pretty much taken over a lot of this and wasn't giving them a lot of contacts, as well as the fact that our case counts were much lower back then. But as our case counts have gone up and DOH is passing through more of this work to Coe County, we see that they're doing a considerable amount of work on a biweekly basis and by and large being very successful in what they're attempting to do. The last slide here, I just want to take a moment and mention for the public the difference between case investigations and contact tracing. So when a new positive case is recorded, that first contact with that individual is called a case investigation. And it's at that first contact that the individual is asked for a list of potential contacts who they may have had physical contact with and need to be made aware of the fact that they've potentially been exposed to COVID. And then those follow-on communications are considered contact tracing. So this case investigation is very important because it's the first step in the process, and it's what makes available the list of contacts to be reached out to provide education and to provide quarantine advice too. In this case, again, although Coe County is doing a great deal of work in this regard, if you would add up the sum of all of these numbers in a 2-week period, what you see is that our success rate in this regard is much lower. In fact, we're only seeing about 35% of the people who Coe County reaches out to in a 2-week period even getting back to them to begin the process. And then an even smaller number, down around 6 or 7%, who are actually returning what is called the CIQ, or Case Investigation Questionnaire. And that's the document that allows Coe County to then move forward and reach out to those contacts. So we want to use this slide to encourage the public to be a proactive part of that case investigation process, work with Coe County or Department of Health in trying to develop that list of contacts so that we can give a heads up to people and let them know that they've been exposed and it would be prudent to take appropriate precautions to mitigate the spread of the disease another step beyond that first person that was exposed. So, Commissioner, with that, if there are no questions, I hope we covered that well for the Coe County piece, and I'll bounce it back to you.